This is WFYI News Now. It's August 28th, and I'm Abriana Herron. On today's show, $10 million for rental housing to support people with substance use disorder. Gun violence remains an issue in Indianapolis, and young people are among the victims this year. And lots of couples like having activities they do together, or maybe they buy gifts as a form of affection. For breast cancer survivors, maintaining that bond is particularly important.
Because of the, some of the changes in the roles and the routines, some of the caregiving responsibilities, on top of managing things that you're already managing, like work.
Those stories are coming up, but first, in most counties in Indiana, children under 5 can register to have free books delivered to their home. It's part of Dolly Parton's Imagination Library, and in recent years it has expanded across Indiana. But children in Marion County are still lacking access to the free book program. From WFYI's Education Desk, Sydney Dauphiné brings us this story from content partner Chalkbeat, Indiana.
Dolly Parton's Imagination Library is a free book gifting program that started nearly 30 years ago. It's available to children in 85 counties in Indiana. In Marion County, many children are still waiting for an Imagination Library. Right now, only 2 Marion County zip codes on the east side of Indianapolis can enroll in the program. That leaves an estimated 60,000 children in Marion County who need access. In Indiana, the state pays for half of the book, and a local partner is responsible for the other half. But the program's coordinator says getting local partners to pay can be tricky for areas with larger populations, like Marion County. Staff at the Imagination Library say the goal is to close the gap in access by the end of this year. I'm Sydney Dauphiné.
Indiana wants to create rental housing developments with supportive services for people with substance use disorder. As Indiana Public Broadcasting's Abigail Ruman reports, the project will be funded by $10 million of national opioid settlement funding.
The goal of the program is for a nonprofit developer to partner with a certified treatment provider or certified recovery community organization. The provider or organization will assist residents with supportive services, such as mental health counseling, life skills, and coaching. The Indiana Housing and Community Development Authority says it will request proposals for the developments in late September. It will score the proposals and select 4 respondents to receive up to $2.5 million each. The agency says it intends to select the highest scoring proposals from 3 geographic regions in the state: Northern, Central, and Southern. The 4th proposal selected will be based on score regardless of location. For Indiana Public Broadcasting, I'm Abigail Ruman.
Gun violence remains an issue on Indianapolis streets. WFYI's Farah Ussery reports the dozens of victims this year include young people under 18.
A toddler and an adult male have been killed in a gun violence incident on Monday night, Indianapolis police said. And it's far from an isolated incident. There have been more than 300 gun-related incidents across Indianapolis since the start of this year alone. Young people under the age of 18 were not spared. Since the start of this year, around 13 young people have been killed and 30 injured in gun-related incidents across the city. I'm Farah Ussery.
And for our final story today, having a romantic partner can be similar to having a best friend, someone to hold your hand through scary situations and make you laugh to ease tension. It's especially important for breast cancer survivors. Side Effects Public Media's Elizabeth Gabriel reports on a new data analysis which found that a supportive romantic partner can lead to better mental and physical health for breast cancer survivors.
Donna Wilson was diagnosed with invasive ductal carcinoma 2 years ago. It's a common type of breast cancer. Now she's cancer-free. And Wilson credits her recovery to God, her doctors, and her partner.
Well, it was very tough for me, of course, because, I've never been through anything like that. Fortunately, I do have a strong village and had Greg there with me.
She's talking about Greg Fletcher, her partner. They've been together for 11 years. One of the ways the couple spends quality time together is by watching television shows and movies.
Whatever movie we're watching, she'll be asleep within probably the half. If I'm watching something she's not interested in, she pretends to be interested in, she'll be asleep within a half hour.
I'll be asleep, but I'll wake up, every so often and say, okay, what happened? So, yeah.
They say the time spent together nurtured their relationship and helped Wilson in her cancer recovery. A new data analysis of nearly 400 people shows that breast cancer survivors who don't have a satisfactory relationship are more likely to have poorer mental and physical health. Dr. Eric Vachon at Indiana University is the study's lead author.
There was worse depression in those individuals who had worse satisfaction between the survivor and their partner, and then fatigue. They also had issues with poor overall quality of sleep.
There are roughly 4 million women in the U.S. who have a history with invasive breast cancer, and research shows a third of them experience mental or emotional distress. And women of color, especially Black women, are more likely to experience these symptoms. Vachon says his study is unique because most breast cancer studies don't include partners. But he says their perspective is important because the stress of supporting a breast cancer survivor can take a toll on a partner. That can look like a lot of different things. Fletcher says as his other half was going through chemo, he was also starting to feel some of the same side effects.
You know, one afternoon I just had this chlorotic smell, couldn't get away from it. And then, there was times I just felt tired. I didn't know why I was feeling tired. And so she said it's a possibility of side effects.
That, coupled with potential issues with intimacy and sexual functioning, can change a survivor's dynamic with their partner, says Becky Nappy. She's an independent licensed social worker in Ohio.
People can experience caregiver burnout because of the, some of the changes in the roles and the routines, some of the caregiving responsibilities, on top of managing things that you're already managing, like work and keeping up with that. There can also be dealing with some of the financial stressors.
She says some people have to continue with hormonal treatments for potentially the rest of their life. So beating cancer isn't the end.
And oftentimes that's when you've got family and friends saying, you're a survivor, you made it through treatment, but you're still dealing with the emotional effects.
On the flip side of that, the experience of breast cancer can be a catalyst for some people to reflect on all aspects of their life and relationship dynamics. Alex Murray is a psychologist with the Cleveland Clinic's Breast Center. She says that could bring about positive change and hope.
I think that being able to kind of reflect on the cancer experience as one that could absolutely be traumatic, but can also lead to post-traumatic growth.
It's been about 5 months since Donna Wilson's last hormone therapy, and she says things are still going strong with her partner. The couple have put in the work to make sure they have a happy relationship, partially so she can stay in good health.
I would have made it through it, but, I think that him being here made the world of difference.
Medical professionals recommend survivors and their partners engage in strong communication, set boundaries, and be compassionate with themselves and their partner. Elizabeth Gabriel, Side Effects Public Media.
That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.